Every NHS organisation would like to be able to tell its patients that they owe their treatment to both medical professionals and to the public. In Norfolk, that's exactly what's happening. NHS Norfolk has created a new and innovative system that puts patients at the heart of those important choices. It's called Programme Commissioning and gives clinicians, managers and patients the power to choose and monitor services together, helping to provide better care for everyone.
I think we realise that if we want to get the best processes for patients, we need to have clinicians involved in the process of developing pathways and making sure that those processes come to fruition. Last year we had meetings between healthcare professionals, social workers and representatives from patient groups to look at how we could improve stroke care in Norfolk. Out of that process came a new pathway which we then put out to tender, and we're now in the process of negotiating, quite excitingly, new ways of caring for people to get the best outcome for them.
That's just one success among many so far. NHS Norfolk is striving to become a world-class commissioner by bringing together the entire range of NHS services in Norfolk into 8 commissioning programmes.
Because to have your arm all fixed, you have to go off for a little sleep.
At Norfolk and Norwich University Hospital, the thoughts of these young patients and parents could very well shape outcomes in future, ensuring better health and well-being for all.
I think that the benefit that each get from the other in terms of their understanding is immense, but I think what we get in terms of improved services for patients is enormous too. How we commission, how we actually secure the services that people need is very big business, and it's very important that we get it right, and for us that is about the needs of the patient and putting the patient right at the heart of the services that we are trying to procure, making them better, making them more sensitive to their needs, and really driving quality in the patient experience into our commissioning.
This is the Long-Term Conditions Programme Board, made up of NHS Norfolk managers, social services staff, medical practitioners and patients.
Carers are going to be far more involved in having a say in how services develop.
Patients, carers and potential users of healthcare in Norfolk are then involved in prioritising decision-making and making sure it provides value for money before the NHS board give it final approval.
I think the only way forward is for everybody to work together. If you decide that you'd like to have a choice in maybe how the money should be spent, or that you have a voice that can be put forward, why shouldn't it be? I mean, we all pay our taxes, we all have a chance. How can you moan about something if you're not prepared to put your opinion forward to it?
In fact, people across Norfolk are now benefiting from the full involvement of people receiving and giving care.
We will not be world-class commissioners if we are not fully offering those opportunities, not just to engage, but to actually be involved and to have an influence. What you get out at the end of it is a product that's so much stronger.
The approach here is already proving itself, aiding innovation and patient outcomes, and helping NHS Norfolk to be leaders of the local NHS.